This video was made possible by Mzizi International, the official African diaspora clothing brand. Visit mzizishop.com for more information. As South Africa's election looms just around the corner, the political arena is ablaze with strategic maneuvers. President Cyril Ramaphosa has taken a bold step to secure an advantage by endorsing a groundbreaking healthcare bill aimed at extending coverage to all citizens. Yet, this move has ignited a fierce debate, with the Democratic Alliance vehemently opposing the bill. So what lies at the heart of this contentious legislation? Before we dive into our topic today, if you haven't already, please consider subscribing to our channels and ringing the bell to be notified about all our exciting future videos. President Ramaphosa's decision has set in motion the most significant transformation in South Africa's healthcare landscape since the demise of apartheid 3 decades ago. While the bill pledges universal healthcare access, its adoption has sparked outcry from the Democratic Alliance, branding it as a death warrant for healthcare in the nation. The opposition raises concerns over the potential astronomical cost and the specter of corruption looming over the proposed scheme. The healthcare insurance scheme proposes the establishment of a government-funded pool to finance the healthcare expenses of all South Africans, the majority of whom are currently uninsured. Additionally, it prohibits individuals from obtaining private health insurance for services funded by the pool, a provision that has stirred significant controversy. According to the government, once a benefit is covered by the NHI fund, it will no longer be eligible for coverage by private medical schemes. This stands in contrast to countries like the UK, where the publicly funded National Health Service operates alongside the option for individuals to purchase private medical insurance for treatment from private practitioners and hospitals of their choosing. According to information provided on the parliamentary website, South Africans will no longer be obligated to make direct contributions to a medical health scheme in order to access quality healthcare. Once the NHI scheme is fully rolled out, the function of medical schemes will undergo a transformation, focusing on covering services not reimbursed by the NHI fund. Private health insurer Discovery describes the scheme as unprecedented globally. In most other countries with some form of health insurance, individuals have the freedom to purchase additional private health insurance coverage, even if it overlaps with the services covered by the national system. While the government does not yet outline the specific treatments that NHI-accredited private hospitals and GPs will be required to offer, it assures that covered services will include emergency care, mental health services, palliative care, and rehabilitation services. President Ramaphosa asserts that the national health insurance is a vital tool in addressing poverty, highlighting its potential to alleviate financial strain on families by providing affordable health care. He emphasizes that the NHI will free up resources for other essential needs and make healthcare more accessible across the nation. With the NHI being a centerpiece of the African National Congress's election campaign, Ramaphosa has pledged to end healthcare disparities between the rich and the poor, aiming to garner support from voters. Conversely, the opposition Democratic Alliance strongly opposes the NHI, warning of significant tax increases and expressing concerns about the potential corruption within the centralized fund controlled by the ANC. The parliamentary website outlines 3 primary sources of funding for the National Health Insurance Scheme: general taxes, contributions from individuals earning above a specified threshold yet to be defined, and monthly contribution from employees to the fund. However, specific contribution amounts and total funding requirements remain unspecified by the government. Despite these, the parliamentary website asserts that the NHI will reduce the overall cost of the healthcare system, currently ranked as the world's most expensive. It assures that healthcare visits will be fee-free under the NHI, similar to how medical aids cover their members' costs. In contrast, the opposition Democratic Alliance criticizes the scheme, alleging excessive taxation of South Africans and estimating its annual cost to exceed 200 billion rand, with some projections reaching as high as 1 trillion rand. The Democratic Alliance declares its intention to pursue legal action to halt the implementation of the National Health Insurance Scheme, arguing that while it advocates for universal healthcare, the NHI will dismantle South Africa's private healthcare system, undermining efforts to improve the public health sector. Recent reports highlight opposition from healthcare associations representing thousands of professionals, signaling a potential wave of litigation against the government, including the South African Medical Association. Central to the dispute is the contention over the legislation's restriction on individuals' rights to obtain private health insurance, which critics deem unconstitutional. The government rebuffs these claims, asserting its obligation to provide equal health services to all citizens, irrespective of wealth. The debate is expected to escalate to South Africa's highest court, where the fate of the legislation will ultimately be decided. However, even if the Constitutional Court approves the NHI, its implementation is likely to occur gradually over several years due to financial constraints, exacerbated by the country's deep economic crisis, posing significant challenges for service provision across various sectors, including healthcare. The government highlights that only approximately 14% of the population can afford private medical care, yet cost continues to rise with minimal improvement in health outcomes. Meanwhile, the remaining 86% rely on overburdened state clinics and hospitals. To address these disparities, the government introduces a scheme ensuring access to healthcare for both rich and poor without upfront payments, particularly for emergency treatments. However, private hospitals express concerns that the scheme may overwhelm their facilities, potentially leading to financial strain if the NHI fund is inadequately managed, leaving payment uncertain. Considering the resistance, financial implications, and the intricate nature of this legislation, its execution could face significant challenges. However, what are your thoughts on this bill? Do you believe it holds the potential to revolutionize the healthcare sector by ensuring quality care for all? Or do you view its objectives as overly ambitious and impractical? Let us know in the comments. If you enjoyed this video, be sure to like, comment, share, and subscribe to the New Africa channel for more exciting future videos.